What happens if chiropractic doesn't help? Now, where do you go when chiropractic didn't help your pain? Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical here in Amarillo, Texas, and I have patients all of the time tell me that they went to a chiropractor but that it didn't help them. Or they've tried things like maybe spinal decompression or cold laser or whatever it is, but that it didn't help them. They got no relief. And when I mention exercise, I've had patients tell me that they already went through physical therapy and it didn't do them any good. And taking this even further, I've had patients tell me when their medications didn't work or when their surgeries were failures. Now, I want you to keep in mind as we go through this, as you watch this video, are there any friends or family members of yours out there that need this message? And if so, make sure they see this video. It really can make a difference. For every treatment out there, there's a failure rate. And you can count on that. You can depend on it. But does that mean that it can't help you? Well, here's a key concept I want you to remember. Just because chiropractic didn't help you, it doesn't mean that chiropractic can't help you. And just because physical therapy didn't help you, it doesn't mean that physical therapy can't help you. Or massage, or acupuncture, or what have you. Okay, my point is that treatments work. We have research that proves this. But not all providers are the perfect fit for a patient's very specific issues. And sometimes a patient, they just need a change of scenery and a different provider. Many times, a provider's specific set of skills is a better match for a patient's specific condition. Where you couldn't get any relief from one provider, you can finally become pain-free from a different one. I encourage patients to try a short course of care of their preference with a different, evidence-based, patient-centered, and reputable provider, even if that type of treatment wasn't effective for them previously. As an example, I have 2 fellowships, one in orthopedics and neuromusculoskeletal medicine and one in forensics for medical, legal, and expert witness work. I have a certain set of skills many other chiropractors do not have. However, there are patients from time to time that simply don't present with the issues that fit well with my specific toolbox and skills. Those patients are either looking for a style of chiropractic that I don't offer, or there just simply is a better chiropractor for their specific condition than I am. I hate to admit it. And no provider can be an expert in anything and everything that comes through their doors. It's not possible or realistic to expect them to be experts in everything. Some providers might think they can handle anything and everything, but they're not right. They're wrong. Not one provider can be an expert in everything. They just can't. Great providers should know when something is in their wheelhouse and when something just isn't. Now, when it is not within their capabilities, that patient needs to be sent to someone that has a better chance of resolving their pain. Sometimes that's chiropractors having the guts to send the patient to another chiropractor that might be a better fit. Sometimes it looks like a physical therapist sending their patient to a different PT, or even sending them over to a chiropractor for a different set of eyes and skills. And wouldn't it be amazing if medical doctors understood how we as chiropractors, evidence-based, patient-centered chiropractors, could help their patients, and if they started sending the appropriate patients to skilled chiropractors? Whew! That'd be a game changer right there, but we're still waiting on that one. But I do have to say, those relationships, they improve every single day. Now, getting back to the point, what happens when you go to a chiropractor and it didn't help? Well, you go to a different chiropractor and you do a short-term treatment trial. If you get a good feel for the doctor, for the diagnosis, a good feel for the office and the staff, and a good feel for the recommended path forward, well, give it a shot. If you aren't seeing results in a handful of visits, you tried. Keep moving. Try a different provider until you finally find the one that changes your life for the better, the one you'll talk about for a generation and tell your kids about. Keep searching until you find that provider. They're out there. Be an effective advocate for your health and find them. Don't settle when it comes to your body and your health. Now, if you're from the Amarillo area or you're going to be passing through and you think that maybe we might be able to help you with medical services, chiropractic care, or exercise, massage, or acupuncture, we do it all here. I want you to call us at 806-355-3000 and let's get you on the schedule. If you're watching on social media, please like, share, subscribe, and do all the stuff. It really does help us out. Until next time, stay smart, and we'll see you then.